I'm going to talk about what is a logic model and how does it help me organize my research. So why would you use one in health research? How do you build one? And go over some examples and references and resources that you can use. So we're going to start with a example, and I picked one that was fairly salient in our sort of local context of vaccine education. So pretending that we had a program, maybe some individuals were interested in improving vaccine information awareness. How do they want to get that information out there? And oftentimes this mimics what the kinds of requests that we get in research services for that information. So they'll say, I've got a bunch of ideas. I want to have a website with the information. I want to have public info sessions, social media, posters in doctors' offices, and info for nurses. And usually it's a checklist of different things that they want to engage in. But when we create a program, an activity and intervention, how do we know X is going to lead to Y? How do we know that all of this is going to lead to something that improves vaccine education, information, and awareness? So, and some of the questions that come from that are, well, do we know that these actually happened the way we thought they were going to happen? Did it actually lead to some other outcome that was perhaps not measured, unintentional? And what resources do we need to make all of this happen? And are these the right activities to get to whatever your goal is at the end of it, whatever you feel your goal is for vaccine education? This is where the logic model comes in, and it is a tool often used in program evaluation. It's a visualization tool for applied research. And as I mentioned, its origins are in program planning and evaluation, but we are seeing it increasingly more in health research because of the nature of the research questions that were being asked and that we're trying to have answered. And you see this more in the terms that are out there, implementation science, knowledge translation. We're really trying to do more of this, bridging that gap from data to practice, and a lot of that comes with more applied work. So really, logic models are just a way of illustrating, and it can be as simple or as fancy as you want to design them, how we think doing an activity will lead to a particular outcome. And underlying that is this sort of assumption of how this change happens through that black box, this theory of change. So basically, it's the what we did, how we did it, and the so what, sort of the outcomes. And it's a really great tool to help map parts of the project, and it can focus on any level as well of a project. So you can have a logic model that is very detailed about a program. I'm going to implement an educational program, and it's these pieces and steps. It can be more strategic and higher level, so maybe you want to design one for a research program that sort of communicates to funders, this is the kind of work that I am proposing. Here's very broadly how my studies are linked together. And we'll look at some examples of that in a little bit. So the anatomy of the logic model is very basically this, where you have a situation, you have your inputs, what goes into it, and then what comes out of it, what directly happens because you've done your inputs, so your activities and who you reach, and then your outcomes. Your short, and usually people divide those up into short, medium, and long-term outcomes. And oftentimes underneath they'll illustrate, they call them assumptions or moderators, the things that more or less can sort of run your program askance and kind of derail the whole operation. So what are the things you need to consider in terms of context, policies, political, environmental, social, technological considerations that are out there that could make or break your program? This one is presented in a fairly linear fashion, and if you Google logic model if you Google it, it will show you oftentimes a very linear process. But again, you can also see very different designs. This is the basic one, and it helps you to get started that way. So the first thing I'm going to start with describing in the parts of the logic model are actually one step ahead. So usually your first column is your inputs. But I'm going to start with the activities. because these are oftentimes what comes to us when we are in research. An individual will say, I have an idea, and the idea is often what they're trying to do. It's what I want to do to make a change based on their experience and knowledge of the situation. So really thinking to yourself about whatever your programs are, what is it you're trying to make a change about, and is there a logical order to these events? So is there, one of these activities has to happen in order for the other activities to happen. So you want to start, when you start thinking about your program, is, okay, listing everything that you're going to be doing, and then figuring out is there an order inherent in it. Sometimes there is, sometimes there's not. So if we go back to our example of vaccine education, we had a whole list of things. We had like information letters and brochures and web material and social media. And really it was getting at two kinds of activities. And if I've been talking a lot this week on Twitter about things relating to this knowledge translation as it's Science Literacy Week. And the one I was talking about today was the different kinds of activities one does, either passive or more active engagement of knowledge user. So in this case, it really is kind of a very passive activity. We're distributing information in various formats. And then we're hosting public talks to maybe engage, collaborate, discuss ideas about the information at hand to increase education. So your activities are the things that you do. And then, so what you need to do first is to list all of those, and then think to yourself, okay, what is it I need? What do I need to do that? This is where the inputs come in. And this is where I would say, out of any of the programs or projects that have come to me, when they've said, I really want to try and figure out what resources I need to make this happen, or I want to make this happen, the inputs is where perhaps there hasn't been as much consideration, but needs to be, and this is where we can identify a lot of challenges that can be prevented down the road. So it can be financial inputs, personnel. So we often forget when we are designing programs that us as staff, on the teams, we are inputs into these programs, and we have to account for that in our logic models. Financial, be it direct costs that we're outlining. If I need to go print a bunch of materials, where am I printing that? Whose budget? How am I doing that? Do I need to hire somebody to create content, or to present printed technology? One of the ones that I find is assumed is having a computer at hand, and then you realize quickly, oh, I don't have a laptop to enter my data when I go and create this clinic that's going to do X, Y, and Z. And then just different information and different partnerships as well. It's a good place here to outline your potential funders, in-kind support, that kind of thing. Basically, you can make this part as detailed as you want, depending on the purpose of your logic model, but you needed to really outlay and communicate everything that needs to make this happen. So back to our example, the information letters, these are really, all of these different examples here were inputs. They weren't necessarily activities, because we're going to distribute them and we're going to host talks with the slides that we create. Those are the activities, and these are the inputs into that material. So you want to ask yourself, who's going to be creating all this information, this content? I would ask the person with this example, how is it being produced? Are you in-house designing, if there's any of that element, what have you? And then what are your costs? And then, again, taking it back and saying, okay, do I need to hire staff? Do I need to bring other people on board? Am I assuming that 0.2 of my time is going to be dedicated to this program and this project? And what I find here is that this is where individuals will quickly either scale back from what they're originally going to propose, because we tend to do that in research. I know you get excited, you come up with a lot of different ideas, and then, oh, right, someone has to do this, and I'm going to be a lot of time and money and energy into that. So this is where I find this is a good gut check to say, okay, let's scale this back a bit, maybe depending on what we have available for resourcing. But it also is a good place, too, to then identify maybe this is highlighting I need to apply for a grant, and then engaging us in that process. So thinking back, so we've, talking about the activities, that's usually the easiest one to come up with, more or less, because we know what we want to do. The inputs, I would, aside from the questions I get at sort of the details around the inputs, I would say, ask yourself, what are the key resources I need to make this happen? So your resources will lead to you doing the activities, and then you're going to have something happen. And what that is then has to be measured in some ways so that we know that a program has taken place, something has happened. And we differentiate in the logic model between an output and an outcome. This is often a frequent source of confusion, but to clarify, outputs are really the direct, tangible result of your activity. How do you know your activity happened? And this is another assumption that we come into contact with, where there's, people think, I'm going to do this program, it's going to increase awareness about the importance of vaccines. But then when they measure, is that, well, the activity actually we never actually delivered those talks in the way we thought we were going to, or we didn't deliver them at all, or put those posters up in the doctor's offices. So you always want to measure your outputs, and they're just basically indicators that the activity took place. So if you're proposing to do X and that that leads to Y, you want to make sure X actually happens, if that's important to this whole theory of change to get to your eventual outcome of increasing awareness. Outcomes are more, how do I know it worked? And this is where we can see a lot of the opportunity for research to build in studies to answer that kind of question. If I think back to my example with information, the information letters, etc., how do I know any of that happened? How do I know I distributed that information? How do I know I hosted my talks? And oftentimes it's very simple indicators. So, how many people, I had X number of talks on these dates, and this many people came. I had X number of website visits because I created a website with information, and they clicked. And there's all sorts of metrics, digging into that. So, which is referencing what I say on the slide, that indicators can be either manually generated. So, like we have at the front of the room here, we have a little sign-in sheet. That would be an indicator that this happened. Website visits, things like that, those can be more automatically generated. So considering, where am I going to get my information? Do I need additional resources to collect that information? Or is it something that just comes with whatever it is I've designed? So the outputs and the activities are very directly linked. The outcomes they get broader and broader as you kind of go further out into the timeline. You have your immediate outcome, short-term outcomes. I've seen different examples, and what I would say is whatever terminology you want to use in your logic model, just have an operational definition of what immediate, I mean the next 6 months. Short-term, I mean 1 to 2 years, that kind of thing, because I find it differs depending on the program and on the place and where their background is. But the outcomes is another opportunity, though. This is where we can find some challenges, because we make assumptions that if I hand out this information to parents about vaccinations and why they're important, I'm assuming it's going to increase awareness, it's going to improve knowledge, and maybe I'll say, I think vaccination rates are going to change, they're going to improve. The question is, well, how do you know that? And this is where we have to be careful that we've accounted for that logic, that part of the change in the model. And what we might find is that we would actually then decide to design separate studies. This is certainly where, if you are unfamiliar or unsure, you could certainly consult with our group or other colleagues about how to, designing a research study to get at this kind of data. For the outcomes here, you may do a pre and post awareness survey, just as an example. Would that increase from baseline their knowledge? You could do some data collection, looking at prevalence and incidence of vaccination rates, that kind of thing. So this is where you can actually sort of embed, in a sense, this is where your research studies probably would come into work here, rather than the research study being the activity per se. If we're looking at, evaluating the program. And then where I showed you on the original model, underneath all of these different columns, the assumptions or moderators, and this is where you can communicate to individuals who are going to read your logic model the if-then sort of assumptions, how we think a program or policy will lead to desired outcomes. You may have heard of the term the PEST analysis of political, environmental, social, technological, looking at different factors under those headings and saying, okay, what's happening out there? Is there a new policy that's happened at the hospital that might actually skew my results? That would be an assumption or a moderate you want to at least make a note of, in this month something changed in our practices, and therefore, because we're, obviously we're not operating in that body. So what supports and structures are you assuming to be in place for this work to work? And being, identifying those that are key. So taking it back to your inputs are what you invest, what you do. The outputs in this case would be the activities, and as I was talking about, the outputs would be who, your metrics of who you've reached, how and then the how, or the how well it worked are your outcomes, and how you define short, medium, and long term is really up to you. And then you can identify different pieces underneath that. So if we take all that information and looking back at the example that I made up, I don't know if there is a vaccination education happening, but here's what I came up with. So in this supposed example, we would have a number of inputs, and I've color coded them a bit, so you have different costs. So production costs, salary for staff. You have creation, so graphic design, and evidence, content. Someone's got to dig in the literature to find the right information to then synthesize and put into the brochures and what have you. And then I need human resources, so I kind of color-coded that differently and said, okay, I need presenters, I need staff to do social media, web presence, I need people to go out there, maybe I engage librarians to get evidence. And then generally that links to different activities. So in this case, the dissemination or that sort of passive engagement of knowledge, the brochures, the website, social media. So just some example indicators that one could use. You can use as many or, those are kind of your basic ones. And then public information sessions, how many attended, short-term outcomes. Then you could start looking at things even before that, like satisfaction with the sessions, like doing a quick satisfaction survey could be a very short-term or immediate outcome depending on your program. So yeah, and then your outcomes, it depends on how you want to design that. You can make the arrows are kind of a big part too of the logic model. Some people will leave it in just straight columns and just say the assumption that you're reading it from left to right. Depending on the project we're looking at, I've linked, you can link things to different things to really show, again, how detailed do you want this to be? And again, who's it intended for? Is it intended for your immediate staff? Is it intended for funders? You may want to not muddle it up so much with 100 arrows and all these different links and things like that. So once you've designed it, like anything else we do, have someone else who's not familiar take a look at it. Can they understand what you're getting at with this? Because more often than not, you're using this as a communication tool, so you want to make sure that everybody else outside your group can understand your shorthand ways of representing your program elements. And then update it. As the program runs and moves along, keeping the original, of course, but then updating it, maybe I didn't do the website. Maybe I decided, not going to do that. I would take that out of that and update my model. So you want to make sure you're keeping it honest to the program itself, so you're able to have a good tool to measure against. And then creating a narrative to go with that, because obviously, we're talking about research, and I'll show you some examples in a second, that you're not going to really get at the heart of the research with this. You're going to get a good sense of what's going on, but you're not going to get, the actual the nuts and bolts of the research. You want to create a narrative. You want to, and oftentimes that's our protocol. But I find it's easy to use something like this, so then you can refer the protocol to this, vice versa. It helps to keep folks organized. So, as I mentioned, a couple examples to give you an idea of how this has worked. And these are the examples that I've designed, that I've done for different projects here in research services. The first one was for applying for a grant. Basically, it was a pretty intense sort of project that had a lot of different moving parts, a lot of complicated moving parts. And it was, so this, I knew the audience in this case for my logic model was going to be the funding organization. So it wasn't going to be the other scientists on that. It wasn't going to be the public. So I wanted to show the funders how the goals that we talked about in the protocol were going to relate to the things that we were saying we were doing throughout. And this accomplishes two things. It helps clearly communicate so they know that you're very organized and have a good project management plan in place. It helps me as the one writing the, helping to write this protocol, that the funding application, that it's, kind of trying to keep all these different pieces in place. There were 6 different little sub-studies. There was extra self-report measures, things like that. And sometimes you try to keep everything straight in your head on which piece is going with what. So, and then inputs. Obviously, I don't like using inputs when we're talking about patients. So I talk about where the resources, the sites that we're getting, recruiting our individuals from, and the kinds of people. But as you can see, again, that inclusion criteria that's in that blue box is really just kind of skimming the surface, just to kind of, obviously that would be in the protocol. I think with that one, obviously within the protocol itself, each of the, when I say 3 types of assays to diagnose cancer, each of those had their own sub-study in great detail in different, statistics and things like that in there. So in this case, I didn't actually use everything I've just told you. I didn't use outputs in the traditional sense of the logic model. You can deviate a bit to your purpose. So in this case, I showed that we're going to measure our success in the study through survival rates. Some of them are more traditional outputs, I guess, number of new mutations, biomarkers identified, etc. I probably would, and I think I've created a second one with this study just to say more on the operational level, and here's more resources like lab equipment, like getting into the nuts and bolts of that. So you can have a couple different models depending on the layer of the project and who's reading this. But I think it worked pretty well for that purpose. And then this is another recent one, is that starting a new program, being asked to say, okay, can you help us identify our research priorities for this new clinic that we're opening? So, come and talk with a bunch of stakeholders. We did a strategic planning session and tried to say, okay, what's the purpose of this model? Well, they probably could use it for funding. They were going to use it for themselves as well, to say, okay, when I come up with a research question, because there's always ideas, flowing when you're having, water cooler talks and things like that, making sure it sort of was still honest to what it was our stakeholders said we should be doing. So in this case, we diverged a bit from the linear model and said, here's our clinic, here's the services we provide. Through the clinic, we're going to explore these questions, so kind of a very high level, here's what we're doing, and then drill down a bit more into the details. They weren't research questions themselves. In this case, they were just sort of, again, priority areas they could take a look at. They're going to build their research questions off of the information on this. And then when they do the research, we're guided by these values. So there was a certain, guiding documents that they felt were very useful to ensure that they were aligned with. So we listed some of those values there so they could always be reminded of that, and then through our research, et cetera. So it's a tool they can use for themselves to keep developing research questions, but also then they can take it to funders and say, here's what we're trying to do when we are, applying for more grants. So a couple options. I mean, I think there's infinite examples of different kinds of ways people, once you go online and start looking at different examples, it's it's great to see the different, the creativity too of how people are presenting this information. Why use them for all that? Like, I hope I've made that case. But just to recap, helps you identify missing resources. I kind of scratch these out all the time on pads of paper. When I'm trying to understand if someone's come to us for a consultation about a research project, even if we don't use the logic model at the end, I still have my notes to kind of keep track of where the different parts are. You know, we usually start with an idea of what we want to do, but it usually puts us later in that model, the logic model, like the success we're going to have or the activity we're going to do. So it helps us to fill in those gaps and identify what needs to happen. So it identifies the gaps, it uncovers hidden assumptions. It can help us course correct. And I think we forget about using them in this fashion. And this is why I was saying it's helpful to revisit your logic model time and again. You know, when you set out, you have your program, you're going to start delivering all your information, and, well, things happen in research as they always do, right? So it's good to take a look and say, you know what, I never actually achieved that short-term outcome because of, well, maybe the equipment broke, or I couldn't have that session, or things. So now, geez, can I still get to my long-term outcome here? Do I need to redraw or add a new step? Helps you to check that. I find it really useful in terms of this to share with funders because it shows that return on investment is and where it's at. I think some of the anxiety that folks have when they're saying, you know, I'm going to do this program and it's going to feed all the children and it's going to do all these things, and great, and that's what they promised and that's what they got money for. But now, well, I haven't shown that everybody yet. So how do I do that? Well, you can use this to say, look, no, we have a plan and here's where we're at, and this is where we're going to lead. So it's very good to communicate back to your investors and your funders for that. And I would encourage you to do that. And also then just verifying your own expectations as you get more information. Are my assumptions correct that I thought were the basis for this program? So really to get started, you don't need a lot. You know, I've used Post-it notes and had them on my wall in different columns. I've, you know, pads of paper and pencils or whatever art supplies you can take from you know, wherever. I mean, highlighters, it's really can be low tech. I know there's lots of software. I've used PowerPoint when I'm designing mine eventually for any sort of publication. There's other software graphic packages out there. I just kind of go with what we have. It works great. And gather your information before you get started. Your protocol, your budget justification is a really good document to help identify things. Lab manuals that delineate processes, if that's what you're trying to model. Informed consent documents can outline process too, and they're really good to help. It has inputs. Data from strategic planning, websites, it's really endless. So really, you know, if you're stuck, go online, look for inspiration, but just sketch it out. Don't be afraid to make mistakes, and you can always engage with us in the department if you have any questions about your own particular project or program. So that's really, I guess, a nuts and bolts sort of summary of logic models, why I would encourage you to use them in your research management. A number of resources, so I've tweeted these out already. I'm sharing it on LinkedIn as well. So, but this will be on Skyline. University of Wisconsin, CDC, the Kansas University, the Community Toolbox. Those are awesome resources. Just really repositories of data and information. And 2 papers here, if you want to take a look at in practice uses of program evaluation and logic modeling. One was a clinical trial of how they used allied health professionals for older adults in the ED. And then another one was addressing social inequity through recreation, sports-based recreation. Again, some more applied health research topics that you can kind of get a sense, okay, this could, maybe something I can incorporate into my own work as well. So that's it for today's session, but I'm here for any questions that you might have online or in person. Like I said, you can get in touch by research services or, as I said, I tweet. Those are hashtags. If you're tweeting, please use those hashtags because we try to Our organization tries to share the information and about what we're doing here at Horizon. Yes, that's about it today.